You've probably heard of tennis elbow, golfer's elbow, but have you heard of pickleball elbow? I'm Dr. Christina, the Picky PT, and I like to educate you about your body, common injuries, how you can make movement habit changes, and how you can also do simple exercises to reduce pain and prevent injuries. So what exactly is pickleball elbow? Well, it's either going to be pain on the inside of your elbow, or you can also end up with pain on the outside of your elbow. What causes this? It's usually going to be overuse of your forearm muscles, either your wrist flexors or your wrist extensors. Now, like I said, there's golfer's elbow and tennis elbow are commonly known diagnoses. And typically, if someone's dealing with golfer's elbow, that's going to be pain on the inside. And typically, if they're dealing with tennis elbow, it's going to be pain on the outside. But because with pickleball, you do both backhand swings and forearm swings, you can end up with either. So those forearm swings are often going to be when you tend to overuse those wrist flexors to finish the movement of the swing. And that's when you're going to be overusing these muscles that attach on the inner side of your elbow. That's when we end up with sharp pain here. That gets especially worse when you're doing things like typing on the computer, you're gripping things, you're twisting open cans or jars. That is going to cause that pain, and that is going to be caused by overuse of those wrist flexors. However, when you're doing your backhand swing, this is when you might overuse your wrist extensors, and you're going to have pain on the outside of your elbow that feels sharp when you're also doing things like lifting something heavy or doing, again, gripping something or trying to twist open a jar or a can. So what do you do about this? Well, you want to think about your form while you're playing pickleball. You want to try to keep your wrist in neutral no matter what, and not have your wrist break into flexion or break into extension as you're doing those movements. So I'll show you an example. So what we don't want to do is finish that movement with wrist flexion. We want to try to keep that wrist neutral as we do that. And for the backhand, we don't want to finish the movement with wrist extension, but instead finish the movement with that wrist in neutral. If you can do just those simple changes as you're playing, it's going to greatly reduce your risk of ending up with pickleball elbow. But if you do end up with pain in those areas, this is a great opportunity to do stretching after you're done playing. Holding each stretch for 30 to 90 seconds, you're going to stretch your wrist flexors by pulling your fingers back. It's very important that you keep your elbows straight as you do this, and you're going to be counting from 30 to 90 seconds with Mississippis in between, not 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For the wrist flexors, you can also then pull your wrists down and again count 30 to 90 seconds in order to get more flexibility here, so the next time you play, you don't end up compounding the issue and overuse of these muscles and ending up with pickleball elbow. So if you enjoy learning more about your body and how you can reduce pain or injuries by just making simple changes to your movement habits, do simple exercises, make sure to like and subscribe to this channel so you never miss out on the newest videos.